All right. Thank you all for being here this morning. Good morning.
Good morning.
It is my great pleasure to be here to talk to you about music and what music does in our lives and what music is doing for the state of West Virginia. My name is Dena. I've been a music therapist for almost 20 years now, and only in West Virginia. This is my second year there, so I now know where the copier is in my building, and I know where the bathroom is, and now can get on to the real work. And I was brought to WVU to start the music therapy degree program there. And so I'll talk to you about that a little bit too, and you'll see there's a page that has kind of some little tidbits about music therapy and about the things that we're doing in West Virginia. But I like to personalize this for people because music is one of those things. You'll hear music is a universal language. I don't think music is a universal language necessarily because it's different depending on your culture and your background. But music is universal. It's everywhere, and it is ever present through our lives. So the first question I'm going to put to you is, or the request, is to remember a time when music had an impact on your life experience. We can think of probably thousands of examples if asked, and there are some pictures here that maybe will prompt you into your own memories of places and times when music was really poignant. So weddings, or a particular concert that moved you to tears, or gathering with friends or family members. Some of these pictures are personal, and some of them are just general pictures. We have music at sporting events. It really shapes and frames all of our lives from the time that we come into the world. And one of the neat things for me about moving to West Virginia is a move into a part of the country where I feel like some of those communities in West Virginia, music is still very, very central. That's not the case always, and so it's really neat to see and interact with students for whom that is the case, and then they land with us at the School of Music, and we get to help them grow as musicians, grow as people, and go out and use their music as a way to serve in our communities and in the world beyond. The biggest question to answer is, what is music therapy? I have heard just about every response to, you're a what? Or, is that a real job? Sometimes I hear it from our prospective students' parents. This sounds really interesting. Are they going to move back into my basement when they're done with this degree? Is usually one of the biggest questions that we get from parents. And so I want to make the distinction for you that music is for everyone. And the music therapist will be the first person to tell you that. I came in and our audio-visual people were sitting back there and they asked if I was going to play something for them. And I said, well, I'll play if you'll sing. And they said, no, thanks, I don't want to sing. I said, well, I'm a y'all come musician. So when I have music, so we're all in there together as opposed to me performing for you. So this is a little bit of a textbook definition in that music therapy uses musical elements, so things like rhythm or melody or form or dynamics. We use all of those particular pieces and manipulate those to reach non-music goals. So if I go into a classroom to work with pre-kindergarten children or second grade children with reading difficulties, I'm not there to teach them to be musicians. That's inherent in all of us, even those of us that think we have no rhythm and we can't carry a tune. It's in there. And so that's not my purpose there. My purpose is to use the music to get them to whatever goal they're working on. Sometimes that's a physical goal in physical rehabilitation, or working with a physical therapist or an occupational therapist, or working with a nurse, or working with a special education teacher. So we're always looking at, what is this other goal that the client or this group of clients wants to achieve? So we look at non-music goals, and it's delivered by a trained professional. And this is the part that usually surprises people. Someone who is a music therapist should have the credential MTBC, which means they're a music therapist, board certified. They've taken a national certification exam, and they have a degree in music therapy. Music therapy is a tricky thing because I'm sure if I asked you, how do you use music in your own life, you could tell me, oh, you know, if I've had a terrible day, I go home and I put on XYZ, and within 15 minutes I feel like a new person. Or I have to have my headphones and my playlist to make it through the gym workout every day, or whatever that is. And so that is a little bit of the therapeutic effect that we do for ourselves, but music therapists are trained to go in and look at the situation and how clients or patients are responding, and then be reflexive. We change the music, we change the tempo, we change the song itself, and we help folks process that. So it is a degreed profession, which is what allows me to be at WVU. So if you've followed the news at all in the last 10 to 15 years, you've probably noticed there's a huge upswing in neurologic research and the effects that music has on the brain. I love this particular graphic because you see immediately when music is present what happens to the brain. And it's one of the things that allows, you've probably seen, most people at one point or another have seen an amazing news story of how someone with Alzheimer's responds to music, or how a child with autism responds to music. It's because music is stored in so many different places in the brain that it gives us access. So we don't always know where that access point is going to come. And it's one of the things that is growing and changing our training programs and what the classes that we offer our students. But we do know that music is stored in so many different places that it provides an access point that other therapies sometimes don't. So we don't work in exclusion of other things, certainly, but sometimes we're the last person to get the referral because the speech therapist has tried and the physical therapist has tried, and we get a lot of, I don't know, call the music therapist, see if they can do something. So we get to come in sometimes in those moments where people feel like they don't know what else to do. So let's talk for a minute about how music might frame an experience. I love telling stories, and so from this point on, I'm going to tell you some stories and deviate from definitions and that sort of thing. And the first story I'd like to tell you is about this little guy. He is 2 years old. This is on a raft in the north part of Thailand, in Chiang Mai. And we're floating down the river. And this little guy has incredible language for his age. He was just barely two, about 2 and 3 months. And native English speaker, and was in a Thai school. And had been learning and hearing Thai and learning lots of Thai songs. Didn't speak a lick of it, but was really developing his English. So we're on this raft, and we're floating down the river, and completely unprompted, we get a little song. Here we go, let's see.
Down the car, Papa, my name was Papa, my name was Papa. Down the car, Papa, my name was Papa, my name was Papa, down.
So this is a song about a turtle. As we were floating down the river, he looked on the riverbank, and there was a log that was up on the riverbank, and there were turtles sunning themselves. And he's looking around, taking it all in, and starts singing in Thai this song about a turtle. That connection is made from school to this real life experience of, oh, I know a song about a turtle. The Thai person that was pulling down the river with us was kind of did a double take, like, where did he learn that? And I know this little guy well. He's my son. So I've gotten to watch him and how he takes in music and how that comes back out. But it's such a great, I was not actually filming this thinking, this will be perfect when I'm talking about this at some point down the line. My son is now about to turn 10, so this was quite a few years ago. And this was one of our first experiences as a family in Thailand. But it was such a moment later that in watching it and laughing with family members, I thought, oh my goodness, this is such a great example of how experience is framed by music, especially if we're talking about children and how they start to make these connections and pull things together in their world. So let me move forward and tell you, oh, hang on, before I move forward, because the music's going to start in just a second. So I'm going to fast forward from Thailand 8 years ago to my time in Morgantown. And last year I arrived and was doing all of the administrative kinds of things to get our degree program off the ground. And my connection between that and Thailand is that I was asked about 7 years ago by a dean of a college of music in Thailand to come and start a music therapy program for them. And so I was awarded a Fulbright and was able to go do that and have had a long relationship with them. And the request there was very similar to the request for me in Morgantown. We would like a training program. They wanted a graduate program. So I got there ready to set to work on this degree program and thought, if nobody knows what this is, and nobody can go see it in the community, and nobody's doing it, we can train fabulous people, and then we have nowhere to send these professionals. And so I got to go in and do clinical work instead. So part of my task in Morgantown has been, who do we serve? Who do we serve first? Who do we serve first in West Virginia? And so part of that was the immediate connection in the community in Morgantown, but also across the state. There are about 15 music therapists across the state. There's a longtime music therapist in Charleston that we're able to partner with and send some students to last summer. So we were able to provide some extra services down there. And one of the things that we've been able to get up and running this year is a partnership with the Friendship Room. The Friendship Room is an amazing place. It has been in existence since the mid-60s, and it literally, until this September, was a room, and it is meant for people who are experiencing homelessness, many of whom have mental health difficulties, to go and be. In the winter, in the summer, there's always coffee in the coffee pot. There's always a friendly face there. And they have different, they'll have art programs or different kinds of things. And so we connected with them and they said, oh, we would love to have music. Do you think you could bring some folks in and do that? So we were able to get that off the ground in the fall. And so what I'd like to play for you next is actually what happened within the first 3 sessions of myself and some of our students going in. We went in and got to know, I'll refer back to Alexis, who was talking in the plenary session about going in and saying, not here's what we have to give you, but what do you need? What do you need? What would help you? How can music help you here? So our first sessions were talking to the folks from the community that utilize the Friendship Room. And they said, well, it would be great to have access to some guitars and for you all to come in and can you bring us some music? And so we talked through all that, and in the next, it was the second session, I believe, one of the students brought in big chart paper, and we brought in the song Lean on Me and played and sang, because that's a song that a lot of people know. And then we talked about how that connects to the Friendship Room. That community lost one of their own, a homeless individual that died out on the street. They had a memorial service, and it was a very emotional time for the staff and the folks who utilized that. And so we sort of parlayed off of that experience and had them talk about what does it mean to have this place, to have each other. And so what you're going to hear is the result of that discussion where those individuals rewrote the lyrics to Lean on Me, and then everybody had an instrument. So we have some folks there that play guitar. We bring in drums. We bring in other unpitched percussion instruments. And so you'll hear their version of Lean on Me. I hope, as long as it works. Oh, there it is.
When I walk through the door, I'll find people there.
just a brief pause in the videos and in the stories to talk a little bit about what happens when we introduce particularly live music into settings like the Friendship Room or Ruby Memorial Hospital or into an Alzheimer's Day support group. We know that music relieves the perception of pain. So we're not trying to replace pain medication, but we are using that to augment. Before my time in higher education, I worked in hospice and had some amazing experiences with patients where they weren't ready, they couldn't have more pain medication yet, but we could have myself or another music therapist come in and extend that time. One of my favorite stories is a woman who was bedbound. She was very near the end of life, and she had a terrible time when they had to come in and dress her. She had bed sores, and so when they had to dress wounds and had to clean her. And so I got the phone call, is there anything you can do? We can't think of anything else. We're calling the music therapist. And I said, sure. So I went in. On the days she was scheduled to have those services, I would go in about 20 to 25 minutes before the nursing assistant got there. And I would stand right at her bedside with my guitar, and we would sing all of her favorite songs. Sometimes her family members would join with us. And the nursing assistant would come in and very quietly get all of her things set up and begin her work. And there was this just seamless transition from the music to what had to be done and what she knew she needed. And the music became the focus of that. And this other thing was happening, but the music was the focus of that. So that's a huge honor to get, one, to be invited into someone's home, and two, to get to be that support for people at that point in life. And so we know that it reduces the stress and anxiety, the perception of pain, the need for sedation. There's some great studies in pediatrics and, oh goodness, the word has just left me. Procedural support, so procedures that are really anxiety producing, everything from a simple shot to things that aren't even painful for children can be very anxiety producing in the hospital. And we have great results with having the music therapist there interacting while the procedure's being done, and the children don't even notice. So it's a great relief, not only for the patient, but for the family in those kinds of situations. So we have a lot of great research that indicates lots of positive results. We are a very cost-effective measure to have in place. Your biggest cost is paying your music therapist well. That's it. You got to buy some instruments initially. But other than that, find yourself a great music therapist and pay them, and you get miles and miles and miles out of it. So it's another thing that we really are starting to focus our research on because of the support that we're able to provide to patients and families, but also to staff members and the stress that that alleviates. All right, I'm going to show you another example. This is a Thailand example. So I have spent all these years now going back and forth to Thailand. We started with getting things up and off the ground in terms of clinical service. We're now about to have our third graduating class of master's degree students in Thailand, which I feel so much pride for them about that. And so we go into Sirirah Hospital. Well, Sirirah Hospital is one of the largest hospitals in Southeast Asia and is the largest certainly in Thailand. It's right on the Chao Phraya River in the center of Bangkok. It is the oldest hospital. It is named after the former king who just passed away, after his father. And we went in, you'll see in the front of this video, there's a Thai instrument that is sort of like a hammered dulcimer. And they asked, this is the outpatient oncology unit. So folks come in to get infusion treatments and things like that, and they're there for a few hours and then they head on home. And so they asked for some traditional Thai music, and so I have lots of students that are fabulous at that. So we went in and just did what I call ambient music, which is you've just got music in the background, but it's live music, which is better than canned music coming through usually a terrible sound system in a hospital. And so we finished up, and I happened to be there that day. It was during a visit with some Thai students, some American students, and we were talking with one of the doctors that's a great advocate on this unit. And I made eye contact with Steve. This is Steve. Steve is from England, and he spends his winters in Thailand, and he was there for his chemotherapy treatments. And as you might imagine, a Westerner in Thailand, you kind of stand out. So the blonde hair is sort of a quick cue to people if I'm mingling in a Thai environment. And so I went over to talk to him, and he said, hey, I saw you have a guitar with you. I said, oh yeah, I'm a music therapist, and these are some of my students. He was like, oh, this was so great. And he said, he was telling me about his situation and what he was doing there. And he said, yeah, I play a little bit of guitar. And I said, oh, okay, well, would you like to play? He was like, yeah, would you mind if I play your guitar? And this is what happened. So Steve is a bit of a ringer, and I don't know if you saw the man in the bed next to him, and I don't know how much you know about Thai people, so forgive me if I'm telling you something you already know. Thai people are very understated, and they're very quiet, and the movements are very small, and when they talk on the cell phone in public places, it's the most amazing thing you've ever seen, because they're talking like this. You can't hear anything, but they're having a full conversation with the person on the phone. So, loud American, it's like worlds colliding. And so to see them be demonstrative, that little foot waggle in the bed was huge for a Thai person. That's not part of their culture. That's not really who they are necessarily, and certainly not in an environment like this. So the moment Steve, who is a patient, sits up and starts playing the guitar, I wish you could have seen the rest of the room too, because the room is full of beds of people getting their treatment. The whole feeling in the room changes, and then people start asking for other songs, and the doctor came over, and he ended up playing You've Got a Friend, and the doctor ended up singing, the Thai doctor was singing, and it was just really neat moments that live music creates that you wouldn't expect in an oncology outpatient unit. I'm going to show you this little guy, Mon. This is the first time we ever saw him, and this was one of my very first days. This is an outpatient, government-funded hospital. It's a rehab hospital. They see everything across the lifespan, children through adults. And so I took both American and Thai students in, and we worked with the occupational therapy department and the physical therapy department. And it was a very interesting, harrowing experience a bit. I don't speak Thai. I speak what my husband calls taxi Thai, nit noi, which means a little bit in Thai. I can order food, I can order a taxi, I can haggle a deal, that's about it. And I have some therapy words. But they said, can you go in, can we just give you clients that we think would be good, and can you go in and see them? And I said, okay, sure, that sounds great. And this little guy was recommended. He has cerebral palsy. He was almost 5 at the time that this video was taken, and this is the very first time that we ever saw him. And you'll see he's super compliant. He's not in pain. He's not fighting the therapist. But prior to us going in with music, he's very just kind of hanging out, letting the physical therapist do her thing. Not a lot of intrinsic motivation for his therapy. And so I'm going to show you some clips here of what happened when we went in with him this day. I'm going to stop it there just in the interest of time, but you see the video's clipped. His session with the physical therapist generally lasted about 20 to 25 minutes. We went for about an hour, a little more than an hour that day, and we let him guide that. I'm sure he took a fantastic nap that afternoon. This video goes from him laying there, and did you see how he started to initiate his foot himself? And he's starting to initiate his hands. This clip goes on, and there's a great back and forth between Hannah, who was my intern there, and him, where she's playing, and then he responds. And she plays a rhythm, and he responds. And she played a rhythm, and he responded, but he got the rhythm wrong and corrected himself. Now, for an individual with cerebral palsy to be able to do that, he turned on a dime and did it, the brain has such a hard time for those individuals responding quickly. This is a great population to work with to learn patience, because they have so much to teach us, but you have to sit still and be quiet and let them direct. And so we had been working with him at that point about 45 minutes, and he was up and going and just doing a fabulous job. He ended this session actually by walking assisted on bars down the hall that afternoon. So we went from laying down and then practicing walking in about an hour. This is a really amazing video. We are doing work in Ruby Memorial Hospital through the advocacy of Dean Kreider and Dr. Clay Marsh. We were able to get a position funded in the hospital in health sciences, and it's a shared position. And so Amy Rogers-Smith is the music therapist there. She does some teaching with us in the School of Music, but 80% of her time is developing programs in the hospital. And so one of the first programs that is going to come online is in the neonatal intensive care unit. There is fabulous research about how these neonates respond to music. We know that babies respond best to mommy's voice, and next to that, women's voice, and then children's voice. Sorry, dads, you're in there, but that part isn't, that acoustically is not quite developed enough, and so the preference goes to the mommy, which I'm sure any of you dads in here probably know anyway. But there's a protocol that has been developed to help these neonates integrate sensory input. So at about 28 weeks, we can start working with babies. We start with humming and then singing lullabies. We add touch to that. We add vestibular movement to that, so rocking. And we layer all of those things, and it helps them integrate all of that into their sensory system. What you're going to see here quickly is a device that was developed by music therapy called the pacifier activated lullaby. And it is a machine that is commercially produced now, and it teaches the baby non-nutritive sucking. And so when they suck on the pacifier, the music turns on a CD player. And when they stop sucking, the music stops. And so it has tension settings on it. So what you do is set it so that initially the baby needs very little movement to get the music to turn on. And you can set how long the music plays. So you may have a very low tension setting, and the music may play for 20 seconds. And babies in about a 40-minute time window figure out that response. So they figure out, oh, if I stop sucking, the music stops. So we can up the tension setting, and the music will go longer, and that translates to feeding. And so these babies gain weight sooner, they get out of the hospital sooner, and that translates to dollars, which is great for the healthcare setting. Not only the dollars, but it really translates to infant and family and mother bonding. So we get these little folks up and going a little bit sooner, and they get home sooner, and it's great for them. So I'll show you. I'm going to have to fast forward a little bit through. You'll see what the device itself looks like.
We're going to put the speakers about 6 inches from the baby's
Here, let's see if we can get to
battery.
So there's a pacifier
To the back of the pacifier.
that hooks to this device, which hooks to the CD player.
This is the cord that will transmit the signal from the pacifier to the machine. So let's see if the baby will suck on it.
I'm going to fast forward so you can see.
Yep, that's a lab.
So the great thing about both of these techniques is that they are done in cooperation with the music therapist, but they can be taught to others, so that very often when we're using a PAL, we are collaborating with speech-language pathology and making sure that we're doing everything that we need to do and that we're not out of our scope of practice, and we're consulting with them. And then the other techniques can be taught to parents and caregivers, family members, so that they can utilize those as well. All right. Let's see. So here we are in a shared experience, and I feel like I would be remiss if I didn't have some music and ask you all to engage in a shared musical experience. And I'll tell you that one of my favorite things that I have adopted since moving to West Virginia is Country Roads. This is, funny enough, it's a song that I knew because I had lots of hospice patients ask for this song. And there's one woman in particular in a rural part of North Florida, and I remember sitting on her front porch, this is long before I ever thought I'd be living in West Virginia, singing this song with her, and it was her favorite one. So we had to end every single music therapy session with Country Roads. So I'm gonna ask you to make a memory with me and have a shared musical experience. I feel like I don't have to worry about you knowing the song, right? Almost heaven, West Virginia, Blue Ridge Mountains, Shenandoah River. Life is old there, older than the trees, younger than the mountains, blowing like a breeze. Country roads, take me home to the place, shoot, I belong. West Virginia, Mountain Mama, take me home. Country roads. Thank you.